So the theme of the week is oxygen supplementation. Apparently, this paper was sent to me yesterday for review. I would give him credit in the video, but I know I'm going to totally butcher his name, so I'll go ahead and tag him in the post line because I do appreciate him sending me this paper, kind of hot off the press. That just came out yesterday, October the 20th, same time as the New England Journal paper that I already reviewed yesterday. The paper is titled "High Arterial Oxygen Levels in Supplemental Oxygen Administration and Traumatic Brain Injury: Insights from the Center TBI and the AusEnter TBI studies." This is a secondary analysis of two multi-center prospective observational cohort studies performed in Europe and Australia. The center stands for the Collaborative European Neurotrauma Effectiveness Research in TBI. It is a longitudinal prospective data collection of TBI patients across 65 centers, so massive study network in Europe and Australia between December 14th and December 2017. In this particular sub-analysis, they included all patients that had a TBI necessitating ICU admissions. They underwent tracheal intubation and mechanical ventilation within the first 7 days, and they had to have at least two PaO2 measurements within the first 7 days for this particular analysis. Again, the study was observational, so they did perform some multivariable modeling to attempt to account for some confounding variables. Again, it's not a randomized controlled trial, so there was no assignment to any particular group. This particular analysis included 1,084 patients with 11,577 PaO2 measurements. They also included GFAP protein levels as a metric for TBI severity. This is a relatively novel biomarker used to assess TBI severity after major head trauma. After adjusting for confounders, they found that higher PaO2 and higher FiO2 for 7 days after ICU admission was independently associated with higher mortality rates at 6 months. Also, as expected, the GFAP levels were associated with higher levels of mortality and worse neural outcomes. The take-home point is that they found exposure to high levels of arterial blood oxygen or high supplemental oxygen levels were associated with 6-month mortality, regardless of how severely injured the brain was. So I think in terms of the ongoing theme here seems to be that we can safely turn down the oxygen. And there's a growing body of literature suggesting a potential benefit to dialing down the oxygen with really no evidence of harm by doing this. So I think we can continue to move in the direction of a more conservative oxygen strategy in ventilated patients. We may potentially even offer them some benefit by doing this.